Welcome to the Power of One. Today, we will be speaking with Dr. Erica Harris, who will let us know about the COVID-19 booster shot, who should get it, and why it is important for those people to get the shot. Welcome to the show, Dr. Harris. Dr. Harris, when did the booster shot for the COVID-19 vaccine become available to the public?
Pfizer vaccine, the FDA granted emergency use authorization for this at the end of September 22nd. And they said that this could be given at least 6 months following the completion of the primary series for certain groups of people. And this was expanded more recently at the end of October for boosters for those who received the Moderna and the Johnson & Johnson vaccine series as well. So now pretty much anybody who's been vaccinated in the United States can receive a booster if they fall into certain categories.
And that was actually my next question. So it's been authorized, not approved by the
Correct.
FDA.
Right. So the Pfizer vaccine is fully approved. It has received full FDA approval as of August 23rd. So that means it is a fully approved vaccine. But the boosters are authorized, which means that they have emergency use authorization. And what that means is that based on all of the data that we have, which means that there have been trials that have been done on giving boosters, that they feel that the benefits outweigh the risks to certain groups. So they are not recommending it for all groups, it's only for certain groups. And in those groups, they are saying that the benefits likely outweigh the risks. And this is actually one of the most studied vaccines in history. So we have a lot of data from real world studies, from clinical trials to suggest that there are benefits that outweigh those risks.
Okay, so who should get the booster shot?
Right. So you can kind of divide this into a couple categories. One is depends on what shot you got initially, and then who you are. So I can start with the Johnson & Johnson. If you got the Johnson & Johnson vaccine, which means you got the one shot, they're recommending that if you're over 18 years old, that you should get a booster shot if it's been at least 2 months since you got your initial shot. Nobody under the age of 18 is recommended to get a booster shot yet. So we're only going to be talking about anybody 18 and over for all of the shots. But Johnson & Johnson, if it's been 2 months, they're recommending that you get a booster. And that is largely because of the activity of the Delta variant that we're seeing. And that's kind of what's prompting the, not the requirement, but the recommendation for some people to get boosters. The next category would be people who have received the mRNA vaccines, which are the Pfizer and Moderna vaccines, which work very similarly to one another. Within those categories, there are some people who should get them, and then some people who can get them. The people who absolutely should get the booster shots are people who are at higher risk. And these are the people that we know from experience and from the studies that are getting the breakthrough infections. You may have heard of breakthrough infections. Those are people who are considered fully vaccinated, meaning they've had both of the shots and are still getting either COVID infections, minor or serious enough to be hospitalized. I know that it was in the news recently that Colin Powell died from COVID despite being fully vaccinated, having received both vaccines. And that's very concerning to people. And he was somebody who is higher risk and would have fallen into the category of somebody who needed to get the booster shot. So who should get the booster? Anybody who is 65 and older, we know that those are people that are higher risk. Anybody who's 18 and older and lives in a long-term care setting. So anybody in kind of a nursing home setting, long-term care facility. And then anybody who's 50 to 64 years old, but who has underlying medical conditions. So there's a certain list that the CDC keeps of medical conditions that place you at higher risk of developing severe disease if you contract COVID. This includes things like cancer, strokes, any kind of immune compromise, lung disease, liver disease, diabetes, heart conditions, obesity, even mental health disorders. And if you smoke, that puts you at greater risk as well. And then we go into the category of people who may get booster shots. And these are people who are at additional risk, but not the highest level of risk. So anybody ages 18 to 49 with those same underlying medical conditions, including pregnancy. We know that pregnant women are at increased risk of complications due to COVID. And then ages 18 to 64 who are at increased risk of COVID-19 exposure and transmission because of occupational or institutional settings. So this would include myself, for example, working in healthcare, but not just healthcare. I think we tend to think of healthcare workers and first responders, but let's say you work in transit, let's say you work in food service, let's say you work in retail, and you're just around a lot of people, and we can't control very well who we're coming into contact with. So I would say if you are somebody who has no risk factors, and you work predominantly from home, you may be somebody who does not necessarily need to get the booster. You may choose to for other reasons. Some considerations people have are they live with people who have those conditions, or they're in close contact with people who have those conditions. So for me, I chose to get the booster for a variety of reasons. I have underlying health conditions, and as a physician, I am in close contact with COVID, and it's, therefore recommended that I may get the booster. But also I keep in mind that my children are too young to be vaccinated. So I could get a breakthrough case and bring it home to my children who are not vaccinated. And so that's my way of potentially decreasing, spread to people who could be at higher risk around me.
Okay. So I can imagine that research is being done non-stop.
Yes.
And when I heard on the news that when people get their booster, they can now mix and match,
Correct.
which I thought was very interesting. So if you got the J&J vaccine, then you can get the Moderna booster, which
Right.
I thought was interesting. So is it the same ingredient in all three of the vaccines?
So all the vaccines are a little bit different. Pfizer and Moderna are both mRNA type vaccines, so they work a little bit more similarly than the Johnson & Johnson vaccine does. They accomplish the same thing in the end, which is to get your body to produce defenses against the virus. They just do it in a slightly different way. What they still recommend, to avoid any confusion, is that the primary series, so if you are completely unvaccinated and you go in, you need to get 2 Pfizer shots or 2 Moderna shots or 1 Johnson & Johnson shot. That still has to be the same. They're not recommending that you mix and match the primary series of your shots. But if you've already completed that, let's say you completed that 6 months ago, or for Johnson & Johnson 2 months ago, then you can mix and match. And so when you get your booster shot, the booster of Pfizer or the booster of Moderna or the booster of Johnson & Johnson will be the same. And that's something called heterologous or mix and match boosting. Other countries have been doing that, and they have seen really no significant problems with that. We are currently, as you mentioned, absolutely doing research on not only if there is any problem with mixing and matching, which we don't see any so far from the research. Obviously, if they're recommending it, we don't see any problems with it, but to see if there's a particular combination that may work the best. So we'll see. We'll get more information down the line to see if there's something that works better or best for people. But at this point, the formulations are the same. Now that may change in the future, because as with the flu vaccine, every year we have a different formula for the flu vaccine because the flu changes so rapidly. The virus itself mutates, it changes, and every year it's different. So they have to update the vaccine to match what we think the virus will be that year for us. And so in the beginning of COVID was very, very stable as a virus. It wasn't mutating very much. And then later on, we started to see some of these mutations come out, and the Delta variant is one of those. And so that is something that may change, but for now, you are getting pretty much the same, kind of the same formulation. What I will say is that if you are getting Moderna, you are receiving half dose. So half the original dose compared to the original series that you received. Pfizer and Johnson & Johnson are the full strength. And what they're seeing is that the side effects are pretty much similar between either of the vaccines when you get your booster shot. That's from studies that have been done and from what people have reported to me. I know a lot of people who have had their boosters, and it feels very similar to people who have gotten their second shot in terms of side effects.
That's what I was going to ask. Yeah, mm-hmm. Are they getting sick with the booster shot like they did with the second shot?
Right. So to clarify, there is no live virus given. So it is impossible to get COVID from the vaccine. I like to remind people of that because that is one of people's fears when I ask, why they've not gotten vaccinated. They're worried they will get COVID from the vaccine. And that is absolutely not possible because we're not giving the virus to anybody. What you will feel is your immune system kicking into gear. And that's good news. That's a good story when I hear that people are having these reactions. It just means that your immune system is starting to build up those defenses. And when that happens, you have some of those side effects. The most common ones that people have experienced are feeling kind of flu-like symptoms. You may feel tired, achy, a little bit of headache, joint pain, muscle aches. Some people get some nausea or vomiting. That's a little bit less common, but you can definitely get a little fever. And that usually goes away within a day or two. That doesn't last beyond usually 48 hours. And we're definitely seeing that after the second shot. And the same thing with the boosters. And so people describe it as very similar to what they felt after their second shot if they got the mRNA vaccine.
for those who do not have to get the booster at this time,
Mhm.
are they still protected against the COVID-19 virus and the variant? And break down for me, what if someone received one vaccine shot? What is their protection level as opposed to the person who received both?
Right. So we know that it's having one vaccine of the two-part series is not as good as having two vaccines. Now, that doesn't apply to the Johnson & Johnson. With Johnson & Johnson, you are considered complete after one shot. But with the mRNA vaccines, they're meant to be a two-part series. So if you've only gotten the one shot, you have some protection, but not all. So you definitely need to get the second shot to be considered as protected as you should be. Your body continues to have two processes in the immune system. One is the immediate antibody response, and one is the response that will help create antibodies later. What we're seeing, though, is that initial response dies off over time. We know, though, however, even though there is what we call a waning immune response over time, as there is with any vaccine, that people who are vaccinated, who are fully vaccinated, are still incredibly protected against COVID-19, even without a booster. So the booster, again, is to protect the people who are at highest risk. So in the hospital, when I'm seeing people who have severe enough COVID to need to be hospitalized, who are very sick, they are the ones on average who are not vaccinated. We're looking at, in Pennsylvania, 97% of COVID deaths, 95% of hospitalizations, and 94% of cases are among the unvaccinated. So you'll hear about these bad breakthrough cases. You may know people who have had them. And that's, for some people, that makes them not want to get vaccinated because they think, why am I taking this shot in my arm? I don't know what it is. It was developed so quickly. Why am I going to do this if I'm still going to get sick? And the answer is, you are so less likely to get sick. Even in the face of Delta, this is what we're seeing, that, these are people that I ask them and they say they have not gotten their vaccines. And a lot of them, unfortunately, tell me, I was going to get my vaccine. I was going to get it next week, or I was just waiting to see how people did first because they weren't comfortable being among the first waves of people to get it. But, we're heading into being almost a year into having these vaccines out, and billions of people around the world have gotten the vaccines and have done very well with them. You have a 6 times greater risk of testing positive for COVID if you've not been vaccinated. You have an 11 times greater risk of dying from COVID if you've not been vaccinated. So that is the risk of not getting vaccinated. And so I have seen people who have had breakthrough infections, absolutely, who have needed to come into the hospital. But on average, this has largely become, a pandemic of people who are not vaccinated. So for you, in terms of thinking about whether or not you should get a booster, if you fall into that should category, it really depends, I think, a lot on who you're around, what your risk factors are. And, I think your personal assessment, this is more of a risks and benefits. I think when you talk about should I get vaccinated or should I not, it's no longer a conversation about whether or not you should. It's sort of like you should. It's going to save your life, very potentially. The booster shot, I think, is more of, if you fall into that may category of something that you can think about and do your kind of personal risk assessment with.
Okay. And I did see on the news, which I thought was great, that there are, I don't know whether pills, but I did see that there is medication for those who may get COVID, and if they're in the hospital, this can actually save their lives. So that research is going on as well. Like if someone gets COVID, that they have medicine now that can actually help them and prevent them from passing away.
Right. And that's very hopeful. So what we need to see from that is good clinical trial data. And I'm hoping that, that is something that will help people who do get sick. We want as many options as we can to treat people as possible. Vaccination remains the mainstay. That's prevention. That's preventing people from getting sick in the first place. But honestly, doctors are always looking for whatever tools we can to help people. And there's some people who can't get vaccinated. There's some people who will honestly always be fearful and not choose to get vaccinated for reasons that I understand. And there's also people, when you think about immune compromise, there's people whose immune systems will not work to make the antibodies that are needed to fight COVID. And so vaccines will never be effective for certain groups of people. And so anything we have, any tool we have to fight against COVID, I'm very excited about. So I'm very much into looking at evidence. So when I can see really good, strong evidence for this medication working, I will be happy to add it to my treatment profile for people.
Okay. And do you think in the near future, the booster shot will be available to everyone?
Potentially. I think that what we'll see is that most likely we'll fall into a pattern, at least for the coming next few years, of the booster being available annually, like we see for a flu shot. I think that COVID itself, eventually enough people will be infected with it. And it's the kind of thing that can reinfect you. We know coronaviruses in general can cause infection and reinfection repeatedly. And there's no reason to think that this one will be any different. It mutates enough that you can get a COVID infection and a COVID reinfection. And the same with immunization, that to protect yourself from that, there's a chance you need to get re-immunized like we do for the flu every year. Eventually, enough of us will have been infected enough times that we have built up immunity or have been vaccinated, that the hope is, it'll fall into the background of our lives, the way that the flu is, that people die every year from the flu. Some people get vaccinated for the flu, certainly not enough. But we get some protection from the flu vaccine every year. And I'm guessing that that's what that will look like. I think in certain cases, there are some side effects for especially younger people from the COVID vaccines. Getting a COVID vaccine certainly outweighs the risks. And so they're still recommended for young people, but the boosters may not be, because the benefit may not be there for the boosters in younger people relative to the risks of getting COVID or a breakthrough infection in a young person. So right now, I don't know where that will go with recommending the boosters for 18 or for under 18-year-olds, but we'll see. We'll see just kind of what happens. I think it will probably not be any more than once a year. I know that the focus, honestly, right now, what we're seeing is that the booster shots, the people requesting boosters, is actually outpacing the number of people requesting their primary vaccines, and that is overall not what we want. We want more new people getting their primary series of vaccines, and so getting the word out to people who may be vaccine hesitant, really focusing on the people who need more information, might be willing to get the vaccine but are a little hesitant, and finding out what would help them be more comfortable and get that information out to those people. That is really where a lot of the focus should be, because I can be boosted, my whole family can be boosted, eventually my kids will be vaccinated, but I want other people to be protected too.
Right. So last year during flu season, we really didn't hear anything about the flu, which is great.
Yeah.
You hear a lot about COVID. So has the COVID deaths decreased dramatically? And do you think that there will also be a decrease in the flu cases this year as opposed to 2 or 3 years ago? Because a lot of people are wearing masks. Not everyone wears their mask, but a lot of people are wearing their masks.
I'm hoping so. I mean, we definitely saw a decrease in not only flu, but in respiratory illnesses in children. I saw very few sick children last winter, and normally we are full of sick kids with asthma and underlying risk factors for severe disease from these common, upper respiratory illnesses and the flu, and adults who have chronic illness who are also at risk of, bad complications from influenza. And I don't think I saw a single flu patient last year, which has never happened in my entire career. And we have low rates of flu vaccination as well. I mean, I met, there's a very lovely woman who works in the hospital who I talked to, and she saw me on the news actually getting my COVID shot, and we talked, and she felt compelled to get her COVID vaccine, still won't get the flu vaccine. And I love her dearly, and maybe someday she will. I'm not going to obviously force that on her.
Right.
There's a lot of hesitancy in the community that I work with that around the flu vaccine, like, why do I need it? It gives you the flu. I've never been sick. I don't, and so there's a chance that this winter things are opening up more, and I suspect we will see more flu. But because there still is precaution around COVID and people are still masking, and there is more of this residual awareness of hand hygiene, basic things like hand hygiene, and there is some degree of distancing, I think that we will see less than we have in prior seasons. But I don't think it'll compare to this past winter and how sparse our department was with respiratory illnesses. It was unlike anything I'd ever seen. So I'm hoping, though, that the thought is that we could potentially see less COVID than we did last winter. It certainly spiked last winter. We had a lot of cases, and that was before a vaccine was available. So even though we have low vaccination rates in the immediate areas surrounding Einstein where I work, I'm hoping that we'll get a little bit more. What we're seeing are with the mandates, people now are having to get vaccinated. Some people are very unhappy with that, but it is effective at getting people vaccinated. People who maybe were on the fence about it now are kind of moving over onto the other side because they need to keep their job. And so I think we will see decreases in the COVID rates compared to last winter, and that will help. I think with everything else, our volumes are up definitely in the emergency department. We're treating a lot of people for a lot of other illnesses and injuries, and any preventable illness that we can help is, I think, a positive thing.
I agree. I am still very, very, very cautious.
Mm-hmm.
I have a good friend who my aunt and her mother are best friends. And her mother did work at a daycare, and she was due to get her COVID shot. But before that, she contracted the COVID-19 virus, and she did not make it.
Oh, I'm so sorry.
Yeah, she did. So it's real to me. It's scary to me. It's new. Like, this was all just, new. So now let's just shift gears a little bit. So now I see that children ages 5 through 18 can now get the COVID-19 vaccine. Is it the same dose for the adults?
No. So the children 5 to 11, their dose is reduced by a third. It's actually a third the dose of the adult dose. And what they found is that reduces side effects, and they still are able to make the same amount of antibodies and have the same immune response, which is very, very good. And this was just very recently approved on October 29th. So very, very recently. And, my social media feed is full of my friends and family getting their young kids vaccinated. I'm a little bit jealous, honestly, that, my kids are too young. They're 4.5. So I'm like, should I call the pediatrician and ask? But I know it's too early. I just need to wait. Some of it has to do with, the maturity of the immune system. And I just need to wait until their 5th birthday. But that's what we will be doing on their 5th birthday, unless approval comes earlier for younger children. But I'm not sure exactly when the next group of younger children and infants will be.
So it was actually approved or authorized?
Authorized. Yes, okay. Authorized. Okay. Correct. Yes, it is not. It is only approved. The only approved vaccine is the Pfizer vaccine for adults 18 and over.
Okay. Now tell me something. Since that approval with the actual vaccine, because I know a lot of people were saying, no, it's authorized, it's not approved, it's authorized. Since that approval, did you see an increase in people getting that vaccine?
I'm not convinced that the approval necessarily made people run out to get the vaccine. I think that the mandates that followed it encouraged uptake a little bit more, just because people then knew that, well, my employer now requires it, because that gave employers a little bit more ability to say, well, it's not emergency use authorization, even though you can have mandates with emergency use authorization because we are in an emergency situation. But yeah, I think that for some people maybe pushed them into thinking, okay, well, it has approval now. But I think that there's a lot of misinformation floating around. And I think that there's a lot of people who don't understand emergency use versus approval. There's a lot of people who don't trust government in general and don't trust the FDA, don't trust the CDC, don't trust even medical bodies. So wouldn't trust the American Academy of Pediatrics, and don't trust doctors, and don't trust, mainstream medicine. And so if you are inclined to not trust these sources in general, an FDA approval is honestly not going to mean very much to you. So for other people who are just waiting for that approval, that probably meant a lot to them, and that may have been the final push to get them to get their vaccine. Okay.
So Dr. Harris, do you think the next pandemic is right around the corner, whatever that may be? And if you do you think we'll be better prepared for it?
I cannot say. What I can say is that we are living in a destabilized world that is being destabilized by a lot of the behaviors of humans and climate change. And I think that in part because of those things and because of how interconnected we are, which is not a bad thing, being interconnected, I think it's a beautiful thing, but I think that we have to expect that there is the potential at all times for a novel, typically a virus, to enter our environment that could become the next pandemic. I can't say if it's around the corner. But I certainly think it's possible. And I think that if we didn't learn that from this pandemic, I think we didn't do our homework, we didn't pay attention. And I hope that we are better prepared. I think that you saw that in the Asian countries that were hit hardest by SARS when it originally came out in 2003, that these countries had a much better and swifter response to COVID-19 because they had already had these plans in place. We were caught sort of with our pants down, I'll say. Yeah, we were caught because I think we thought a little bit like this couldn't happen here, that we were kind of this isolated country, and that we have all these resources. And I think that we realized where our holes were. And I think that that is actually really a good thing, in a sense that I'm pleased that the mortality rates for COVID are lower than we initially expected them to be. They're not nothing. We have lost 750,000 Americans. Globally, we have lost close to 5 million people. This is not nothing. And every life that was lost was a human that had somebody who loved them, that had families that people relied on. And so I'm not trying to minimize the impact of COVID. It has disrupted world economies. It has disrupted families. It has disrupted the way that we interact with one another, potentially for the rest of our lives. But I will say that when you look at the mortality rate of COVID-19, we were lucky. The transmission is high. It transmits very easily among us. But the next pandemic may not be so kind in terms of what it can do to us. And I think that we have to take it seriously. We have to learn from it. And I think there's been a lot of bickering about the way things have been politicized and things that have not been absolutely necessary to do in a pandemic. And so I think focusing on some of the positive things that have come out of this, I think that we've learned to connect in really creative ways. And we've learned to share with each other. And I've seen people fill up food banks in the communities because they care. I've seen people really find the best in them when they haven't had much else to give, because they realize that we rely on each other, and that idea that community needs to exist. And so I think from that standpoint, I think we can call on those things again if needed. I think that we have developed emergency plans. I'm thinking at the hospital level, we put into place very quickly emergency plans. We put in place, crisis level plans. What happens if we get to the crisis standard of care, which is we have to ration healthcare resources? And that was one of the most tragic things for me in the beginning of this pandemic was, what do I do if I have to decide who gets a ventilator and who does not get a ventilator? And that was one of the hardest things for me psychologically, that made me so exhausted emotionally and physically in the beginning that I didn't think I could do. We have those in place now. We know what to do if we have to do the unthinkable. We're prepared. I'm hoping that we can do things like more production in the United States of critical infrastructure for things like personal protective equipment and ventilators and things that we don't need to rely on, outsourcing to other places. And so I'm hoping we've learned, and I'm hoping that the message that we learn from all of this is kindness and community at the end of the day, that, despite being separate, we have to rely on one another to get through it. We have to be creative and come up with solutions as a community. And that's how we're going to survive.
I agree. And I thank you so much, Dr. Harris, for coming onto the show. And we've had you on. This is the second time, and that's because you break everything down to where we can all understand it. Thank you so much for being here.
Thank you.
Thank you for joining me today. Thank you for Dr. Harris giving us the information that will educate us on the booster shots around the COVID-19 vaccine. Peace and blessings.